Hello, peoples. I got something to show you. You ready? Look at this. Isn't this great? Ah! Hair! I'm having to actually wash it, comb it. I had to like trim the bushy eyebrows. They came back first and they actually got long enough. They were doing the little tree climbing vines up the face thing, and I had to get a bushwhacker after them. And what a terrible problem to have. Just terrible. I'm happy. Medical update time. I went to the oncological surgeon. Say that 3 times really fast. And he did a close-up CT scan of this whole area right here and rolled through these slices that show up on the computer, and it was really, really interesting. His determination is that the lymph gland does not appear to be adhered to the jugular vein or the carotid artery as best he can determine. He said he is experienced at operating in this area of the neck. He has done quite a number of, I don't know the proper medical terms, so I hope I don't sound too silly, but like excavations, or where they go through and they have to like just start following lymph glands and they pull them out and resect them. You know, they just have to surgically remove them. And he said sometimes they can go up and down and get pretty advanced. That with everything he can tell, it's this one node right here. And he said that he really has no anticipation of problems. But of course, I had to ask about, well, what could go wrong? And there's the normal stuff of, well, there's bleeding potentials and there's infection potentials. And I'm like, all right, but we've got a lymph gland that's right up against these major arteries and veins. Talk to me about that. And he said, worst case scenario is, let's say there was something happened to the jugular vein. He said they can literally just clip it off. He said the jugular vein on the other side has more than enough blood flow that in a last moment, worst case scenario, they can just literally clip it off. And he said, no, I won't know any difference. He said the artery is buried a little deeper and that he's not really worried about it. He said that would be about the worst case scenario. So honestly, the surgery is, you know, he makes it, of course, surgeons are always like this. It's not a big deal. You'll be out of the hospital right away. Okay, great. With a big stinking hole in my neck and an incision. He did say there could be a drain, depending on how much fluid collects. I might need to stay a day or two if the fluid collection gets bad, pain levels really bad, or what have you. So we will see. Today is Friday the 13th, and it's a wonderful, blessed day. Last week was not so happy, as some of you saw on my Facebook post. I've had my 3rd episode of just convulsive, seizure-like, GI, whatever. I don't know how to explain it. It's unlike anything I've experienced before, and it's the whole body takes over and it does what it wants to do, and when it's through, then I get control of my body back. And it's pretty bad. My wife's seen a lot of stuff with all this, and she works in the medical field, and her patients throw up, and it even was hard on her. She basically communicated in a way to let me know that was hard to be around, to see. And I just share that with you because I realize people get sick stomachs and get a touch diarrhea, and I just didn't realize that there could be a scale of such. Like, you know, if you go with the scale, you could have from mild to wild. And then there's turbocharged, and I think I was on the turbocharged side. I cannot imagine it being any worse. And then comes the weakness that lasts for several days afterwards, and, you know, just felt terrible, just terrible. Good news is it seems to be self-limiting, and life goes on. I continue to gain some strength this week. Weather has been conducive to getting out and walking. Completed a 3+ mile walk with Chauncey and her new little 4-year-old rescue puppy dog Zoe. For her 21st birthday, Chauncey was given permission to choose a dog and bring a dog into the home. She's like a major dog lover, which really all of us are in this house. And last year, our beloved yellow Labrador of many years passed away. Hey, you're on my video channel right now. See my name down below there? Click on it, and you'll come up with all sorts of videos that I've done over the last few years. I wasn't real prolific until this cancer episode. But before this, I did a lot of stormy videos of our yellow Labrador. And before that, I did some saltwater aquariums, if you are into that kind of thing. Subscribe, please. Look down there by my name and you'll see a subscribe button. Click on that and subscribe to my channel. It'd mean a lot to me. It helps me out. I think if I can reach 100 subscriptions, it changes something within the YouTube community, how I'm presented, or I don't know that I fully understand it. But anyway, it would be nice if y'all would. Let me share with you a couple of stories, and I'm going to start with a little fella. He is quite the hero, quite the fighter. His name is Joseph. His dad, Luke, joined the Burkitt's Lymphoma Society and posted this picture on there, and you can easily see why we have all adopted him as our own. What an absolutely handsome little guy. And he's quite the fighter. Well, guess who's going through a stem cell transplant right now? Yes, Joseph is. And I'm honored to be able to do some communication and, help out with what little bit I know about it. Just because I've been through one stem cell transplant that I went through does not make me an expert in it. Trust me. I can just share what my experience was like, which is really good. But I'm certainly not like a stem cell transplant nurse who's seen 100 of them and can say, well, experiences range from this to this to this and this. I don't have that base of knowledge. But I feel very honored to be able to support them in whatever way I can. And I wanted to mention that there's been a news story that was released in the local town where they are, and that Joseph he got cards from all over the place as a result, and it was really cool. And it was a heartwarming story. What sets him aside on this particular note is that he's going through right now the same exact stem cell transplant I went through, an autologous, meaning his bone marrow was harvested, kind of cleaned up, rinsed out, and then he was prepared, went in the hospital, underwent BEAM, B-E-A-M, chemo, and then on day 0, they reinfused the stem cells. Blah, tastes terrible. The taste, it like just exudes through your skin and through your nose and mouth and your pores and your hair, everything about you. Well, okay, so no hair, but at that point. But it's a terrible experience to have to go through. Absolutely no fun. It's a lot of boredom, sheer boredom mixed with moments of just terror. The M in BEAM is melphalan, and it's a mean medication. It causes the gastrointestinal tract from the tip of the nose all the way to the very bottom to become extremely sick. And we're not talking like a day or two. We're talking like starting on day +2 until maybe day 14 to day 21. Just sick as a dog. Oh, I didn't cover some of those details in my videos at the time, but I guess I could say it now that I just didn't know that you could do mean things like that to a person and they could live through it. That's the point of these stem cells. without these stem cells to come in and form a fast recovery of the blood cells, which, stem cells make things. And they go flood the body with millions of stem cells, and they just start remaking all this stuff that the chemo came in and killed, and you feel like you're being killed. Well, guess what? Without the stem cells, you would die. Joseph would, I would. They wouldn't even try this. The beam chemo is able to be given only because of the stem cells. Otherwise, they wouldn't even try, because it would kill the patient every time. That's what I've had a couple of my oncologists tell me. They said that the whole point is to give you chemo that is freaky, abnormal high doses that would normally kill a person, but we rescue them with the stem cell transplant. And Joseph right now and his mom and dad are really going through it. Now, he's set apart with one distinction in that he's going to turn right around and have an allogeneic stem cell transplant right after this one. Back to back, boom, boom. And I can't imagine that. We're going on 4 months now since I've had mine, and I still am having side effects and weakness and whatnot, and I can't imagine turning right around and having allogeneic. The allogeneic means it's stem cells from somebody else who's a match. But the hospital stays much longer. The symptoms and problems are typically more intense, anywhere on a scale from mildly so to off the wall. I was told if I had to have an allogeneic, I'd be in the hospital minimum of 3 months. I'm sure not every person is there 3 months. Probably depends on how well they do. If my cancer comes back, I've got a 30% chance of success. If it comes back, I don't know that I would choose to do the allogeneic. My own cells, this process has been hard enough, and I don't know that I have that much fight left in me, to be honest with you. Joseph, you are a superhero. Luke, you and your wife hang on. I'm asking for prayers for Joseph. Please, would y'all pray for him? I want to share with you another story that's going on right now in the Burkitt Lymphoma Society. And this fellow's name is John Sims. I was introduced to him and his girlfriend Lindsay through the Burkitt Lymphoma Society, and it happened about the time I started on my stem cell transplant. They're at MD Anderson, and they reached out and we communicated a bit. And they wanted to know what I was going through, what it was like, because John was getting ready to undergo a stem cell transplant himself. Young couple, I'm guessing in their mid-20s. Y'all forgive me, I didn't think to ask your age. And due to complications, the stem cell transplant was, pushed back and pushed back. And without really going into too many details, it's just been a terrible battle. And there just wasn't a whole lot of good news. And today I found out that the cancer has spread to his brain. In the last 24 hours I found out, and he became quite ill, and they, I talked and said, look, I've got an Omiya reservoir, can y'all do chemo? I was trying to do what little bit I could, which is not much. I feel pretty helpless in these situations. And he's been declared terminal. Would y'all please pray for John and for Lindsay? as they enter into a very terrible time. All right, I've got something to show y'all. Let's just see if I can pick this little gizmo up and just pick this gizmo up. And it's got magnets on the feet, and it was on a metal structure there. Show y'all something. This is one of the few vehicles I can truly say I've ever been somewhat attached to, sentimental attachment. This is our Mazda van. It's a 2003. We've gone on 2 vacations in it, numerous trips to visit family, which is our normal vacation, to go see family. And it's a comfortable ride, it's a cushy ride, it's got a cassette player in it and a CD player, and I mean it's got bells and whistles and whatever all you could want, and we've just loved this thing, and it's got 190,000 miles on it. Good vehicle. It's gone the distance, and it has finally bit the dust. And we kept waiting. You know, obviously with me being on disability, 40% pay cut, it's not the opportune time to go out and get another vehicle. Sometimes opportunity knocks when the timing just doesn't seem right, but the good Lord provides, and things have come together, and we are the happy recipients of that shiny vehicle right over there. Got us a 2013 Honda Civic. Low mileage. Got the best deal one could possibly ask for on it. And I'm a happy man. Really. This thing actually has the ability, I can take like my iPod or my iPhone or whatever, and we can play music through the radio. I know some of y'all are laughing at me, but look, when you drive a vehicle from 2003, it still had a cassette player in it. So, no more cassette players, updating to some modern stuff, and I'm just real happy about it. Really am. Spring is getting ready to spring, if that makes any sense whatsoever. Hey, look at the dogwood trees. I guess that's what they're called. They ought to be called flower wood, because they got flowers and wood. Would you flower for me? And yes, they are, indeedy. They came out before the last 2 weeks of ice and snow that we had, and we had quite a bit for North Texas. And those little flowers started to erupt, and they just kind of stayed in place, and I figured they'd all drop off and then nothing would happen, but our little grove of dogwood trees is getting ready to bloom, and it gets real pretty. It lasts about 2 weeks, and then it goes bye-bye. And then they're just these big green blobs of life. Well, I don't have a whole lot more. Traveled across Texas. For those of you who understand what that means, long day. Went to a family funeral, and it's always nice to see family, always bittersweet. And it was a good trial to get out and have to drive and go that distance, and did pretty good. There's one period where I got sleepy, and I told Janice, I don't think I can keep going without just getting a break. So she took over and started driving, and next thing you know, I was asleep. And for those of you who know me, I'm a light sleeper. To just pass out in a car is not what would be typical for me. And that's exactly what I did. I passed out in a car. For about 45 minutes, just sawed some logs. Woke up refreshed, and it was good after that. So I'm going to go see my mom up in Ruidoso, New Mexico. My oldest daughter, Andrietta, is going to go with me. Looking forward to that. We're going to take that little newer to us car, and we're going to break it in and see how it works. And I'm coming to y'all today with a happy heart, with some twinges of sadness over some of the news that I've reported. And God is good. I just want you to know that despite life's burdens, life's troubles, the greatest commandment still is the greatest commandment. To love the Lord your God with all of your heart, soul, mind, and strength, and your neighbor as self. Folks, that's a whole lot of loving going on. And I want to be all about that greatest commandment. Thanks for watching. Y'all hang in there. Please say some prayers for John and Lindsay and Joseph and Luke and family. And I'll see you next video.